Okay, so I know that my title does not necessarily match what was in the handbook, but that's because I changed it last minute. Still the exact same information, and I'm hoping that you can walk out of here with some strategies. Like I was introduced, I have 18 years of experience as being a physical therapist. I think I have one of the best jobs in the world. My current role has changed significantly. I now work with kids in the schools, and let's get started. So just a couple of disclosures. I am still adjunct instructor of clinical physical therapy at the University of Southern California, where I'm involved in teaching. I do have a sole proprietorship that's called Endurance PT. And really, that's to allow me to see some patients independently when I have time, but I never have time. I work in the schools and I'm a lead for a company that's managing many different programs. But I try to make time when I can. So as I go through this information, you will see that I'm really talking to you. I'm talking to the person with cystic fibrosis. And I know that there are people attending this conference virtually and all over the world, and you really are my audience. So for my disclaimer, the information provided in this presentation is for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Everything shared today is meant to help you understand your options, but it's not to substitute for care from your own medical providers. Please consult with your healthcare team for any personal medical concerns. And that's tough for me because I'm a clinician. I want to help you. I want to make you feel better. But each person with CF is different. Your body's different. Your bone structure is different. Your bone health is different. Your age is different. So what I want to do is bring some awareness to some things that you can do to try to help yourself. So some of the things that I'm going to focus on today includes acknowledging that pain and musculoskeletal problems are common in persons with cystic fibrosis, but underaddressed. There's lots of articles out there that talk about pain, talk about posture, talk about exercise. But I think when it comes down to it, I know that my patients have said there are so many things to do in the day. How do I prioritize some of these things and talk about getting into physical therapy? But there are things that I want us to consider that contribute to these challenges, which includes chronic cough, poor posture, pelvic floor dysfunction, urinary incontinence, and back pain. And it's hard to understand or really know which came first, the chicken or the egg. So physical therapy offers effective management strategies to help with addressing these areas of challenge. But I know that many individuals face barriers to accessing care. So I'm going to start out with self-advocacy. Self-advocacy is essential because it empowers you to actively participate in your care with the ultimate goal of improving your quality of life and health outcomes. So when someone is dealing with some of the challenges that I've mentioned already, I think it's important that you write down what is bothering you. What are your symptoms? Is it a dull, achy pain in the middle of your back that gets worse at night or it travels? Sitting makes it worse, laying down makes it better. Those things help your healthcare providers understand what's going on. And then it's also important for you to be able to verbalize to your healthcare team, can we try physical therapy? Instead of maybe just relying on some pain medication that really just covers up the pain but doesn't address the problem. So how do I find a PT? There's a website called Choose PT that is for physical therapists who are active members of the American Physical Therapy Association. And you can search for them in the area that you live. These clinicians often have a specialty or years of experience listed. That's something that I think is important to you. I think if you're looking for somebody who really knows the spine, you want a certified orthopedic specialist. If you want someone who knows women's health, you want a women's health provider, because these are individuals who have spent an additional 2 years of their time and then taken a giant exam to be able to work in this area that they're passionate about. So that's who you want to help you. But not all of us are on that choosept.com website. So use that same information for your Google search. Look for a specialist, read their bio. And then when you're actually with the PT, be upfront with us. Like, hey, I've got 4 to 6 visits because the rest I need to use for something else because my insurance just changed. Like, we should be able to give you what you need in that small amount of time frame. And if not, we should be able to give you a good explanation of what else you may need. All right. And also consider telehealth. There's something very powerful about being in person with a clinician. They can put their hands on you, they can help you in many ways. However, being virtual gives us so much flexibility. You can be in the comfort of your own home. You can be, I've done sessions in the car, right? Like you have that flexibility. So that's what's nice. And I will be giving you some resources at the end of the presentation for a telehealth service that I believe in. All right. So that being said, we're going to jump into a very big topic. So I'm sorry to say, if you've had back pain, there's a high probability you're going to have it again. But I'm here to tell you, you can develop a recipe or a plan to manage it. I've had back pain myself for 15 years. I got injured 2 years into the job, and I couldn't fix myself, but I went to a PT who was a clinical orthopedic specialist and was able to work with her. And now I have my recipe book, and I can pull out what I need to help me manage my back pain. And that's the same thing that I would like for you. There are seasons in our life where maybe we're hiking, or maybe we're playing pickleball, or maybe we're recovering from transplant. And all of those life experiences will change what we do to address our back pain. Something that I think about is that my CF patients are like my athletes, because when my athletes get injured, it's about getting back to sport. For my CF patients, it's about getting back to the life that you want to live. So you are my athletes. Okay. So what are some things that contribute to back pain? I know in people with CF, you may cough, you may not cough, you may have a lot of mucus, you may have no mucus, but coughing does affect your back pain. Posture. Usually when I say that, people sit up tall and they change their posture, right? Because once you bring awareness to it, then you change your body. But what I want you to know about posture, and as we go through, there's going to be some slides that help us understand what good posture looks like. Good posture is the foundation of health. It affects your breathing, it affects your circulation, and it even affects your mood. So bringing awareness to your posture, it doesn't have to be perfect all the time, but just knowing I'm important and this is how I'm going to carry my body is really helpful. Muscle weakness also contributes to back pain. Which came first, the chicken or the egg, the injury, the bad posture? It doesn't really matter, but muscle weakness is another factor. And then something also to know is that chronic pain shuts off the muscle. It changes how your body moves. So that's why rehabilitation is important, because we're guiding your body to activate the muscles in the way that it should. Okay, so back pain is a complex beast. It's all connected. On this next slide, you're going to see all these amazing, beautiful muscles, and they all attach to the back. So they can all be involved. Sometimes I get excited in these presentations and then I lose my spot. So when somebody has back pain, we're going to ask you, is it, in our head, how long have you had this back pain? Is it acute? Is it subacute, or is it chronic? And acute is 2 to 4 weeks. Subacute is 1 to 3 months. And anything more than 3 months is chronic. I don't want you to be scared about having chronic back pain because I have it myself and it doesn't stop me. And I don't want it to stop you either. And you're not alone. 75% of Americans experience some form of back pain. The most common causes are muscle. There's also disc and then narrowing of the space within the spinal canal. So there's lots of different reasons for back pain. Something that you might hear us say is, what improves your pain and what makes it worse? Does your body want flexion? Do you want to lean forward? Do you want to lean back? What are those things that help? That's something you can also write down if you're trying to hone in on what I want to share with my healthcare team, or even when you're looking at resources that I provide you. You know, I know extension doesn't feel good, so I'm not going to do it. Just some examples. Okay, so here's that beautiful picture of all the muscles that can be involved. And then on the next slide, it's just another graphic, but what I want you to see is, ready? The multifidus here attaches to the spinous process. So here is the spine, and then attaching to each individual level are the multifidus muscles. And when people talk about the core, there's different layers of the core. I'm going to try to focus on the deep core because that's where we need to start to address how activation can help improve your back pain. So going back to posture, our bodies seek normal alignment because that's when everything works as it should. So I'm going to demonstrate something. Can I move this microphone with me? Okay. So I'm going to demonstrate something. I'm going to stand with really bad posture. So if I take a deep breath, that's all I have. I don't have any more. But if I stand up straight from here, yes, I've been talking, but I have more. If you practice that on your own, great. Do it in your room, but it's also a limitation in my range of motion. That's all I got. But now I can come all the way up. So posture is so powerful because it changes the mechanics and how our body activates and moves. So poor posture can cause, now I'm worried I messed up the mic. Poor posture can cause pain. It can cause faulty breathing mechanics, difficulty with airway clearance. It puts you at increased risk of fracture, which is a super bummer. But think about the way that the forces drive through the spine. If you have really bad posture, then that's going to change the way that the forces go through your body. And then poor posture causes or can contribute to stress urinary incontinence. And then self-reported postural embarrassment. I'm thinking about my teenage clients. I'm thinking about those that are out of the teenage years and they're sort of here. And I will tell them, you are important. You stand up tall. Okay, so poor posture. I sit like this red person, and I have to remind myself, Nicole, sit your butt back in the chair, put your feet on the table, on the stabilizer or the table, whatever surface I use. Make sure that my computer is at eye level and sit up straight. Same thing with my standing desk. So for you, it's the same. Now, not all of your information is going to be at eye level, but this is the goal, okay? And it's the same when we're on our devices. How many of us are on our cell phone looking at it like this, right? So bringing it up to a particular level so that it's at your eye level is important for your spine. It's important for your spine health. So what helps back pain? Specific exercises, motor control training, which is that rehab because pain changes the way that your muscles work, and soft tissue work. So yes, that means get a massage. And then also supporting the back when sitting and when sleeping. So remind yourself to scoot back in the chair. Remind yourself to have your feet on the floor. Lumbar rolls is a nice support for the small of your back, but I often find that they're too big, So you may want to just use a towel from your house and see what feels good. Hip and back stretching is important. We'll see some slides in a few minutes about why. But deep breathing while you're stretching is helpful in gaining more range of motion. It's helpful for breathing into all of those tight spaces where you may have secretions. Okay. It helps you relax. And I find with yoga, one of the reasons that I love it and believe in it so much is because it's these big, long, reaching movements of expansion. You're given cues for taking deep breaths, you're holding the position. So stretching is very powerful. And walking programs. I love walking programs, and I'll tell you why in a little bit. So here's an example of a sleep position that may work for some people with cystic fibrosis. And what is nice about it is putting her body in neutral spine. Neutral spine is that lowest with the smiley face. So what happens in the neutral spine position is everything can relax. Everything can just chill and turn off. When you are really tilted backwards, things are lit up, things are on. When you're tilted forwards, it's the same thing. So finding neutral spine is really important to help reduce back pain. So sleeping like this might work for some, it might not. Maybe you can lay flat and you can just have pillows under your knees. Maybe you lay on your side and you have a pillow between your knees. And I realize I would love it if I would have put a picture in. But when you're laying on your side, that top leg is pulling or rotating your pelvis down. So putting that second pillow in helps bring it up and put your spine in a more neutral position to therefore reduce some pain. Okay, more of what helps. So exercise is medicine, okay? And for the most part, it's free. Um, the deep core, this is the deep core. The deep core is your diaphragm at the top, your transversus abdominis, which we'll talk about, which is the deepest layer of your abdominal muscles, the multifidus, which I showed earlier and highlighted, and then the pelvic floor is the bottom. So when we think about the core in physical therapy, you know how some people are like, get a back help. And the multifidus are the ones that tie up in the back. So getting these stronger can be very beneficial. But knowing how to activate them correctly is the most important. Totally went off my notes, which is absolutely normal once you're in the groove, So what I would like everybody to do if you are comfortable is I want you to put your fingers on the inside of your hip muscles. And what I want you to do is just bring your belly button in that much, a tiny amount. When you do that, you're activating your transverse abdominis. Now, when you do that, the key is to not hold your breath. So that's hard, especially if you're a chest breather and you're used to, right? Like sucking it in. It does happen. You can relax. But activating that transverse abdominis is the key. That's the beginning of core activation. So that's one thing to walk away from today, hopefully, is that's how you activate the core. Okay. So jumping from that to stretching, this is why stretching those muscles are important, because the hamstrings, you're looking at the back of the body. Here's the spinous process. So here's your bottom. The hamstrings attach to the pelvis. When that pelvis rotates either posteriorly or anteriorly, that's going to affect the pelvis position, which therefore affects your spine. When you stretch your hip flexors in the front, some of the hip flexors attach directly to the spinous process. So that's why that is important. So the walking program that I mentioned, the reason that I like it is because it's free and it works. Sometimes you don't want to move. Sometimes you don't want to get out of bed. Sometimes I don't want to do it either. I told myself the other day, Nicole, get up and go for a walk. You know your body will feel better. I work in pediatrics and I work with children with autism, and we say that a lot of them don't like transitions. They aren't ready to go to the next thing. And I'm not either. Like, I don't want to get out of bed. I don't want to go for a walk. I didn't want to go to soccer practice. But then when I was there, I loved it, right? It's the same for I'm going to get up and I'm going to go for this walk. There's tons of research, maybe tons is the wrong word because I know my community. There's a lot of research that talks about how much. There's some that says 10 minutes. There's some that says 30 minutes. There's some that says 78 minutes a day. That's a lot of walking. And that may feel like a lot, but know that a 10-minute walk can help get that oscillation in your spine. It's getting that movement in the hips, which helps get lubrication into the joints, water in the disc, which helps reduce your pain. Now, flat ground is best, but I know that not everybody has flat ground to walk on or in, and you may have to drive somewhere, and that's a pain in the butt. So I apologize about that. I will say, if walking in your house is what you can do, turn on that music, listen to your podcast, and walk back and forth. It's better than zero. All right. That exactly. That's your winter. Exactly. So for our friends that live in very cold climates, they're not going outside. Um, all right. It's too icy. That's right. Okay. So we're going to talk about something that nobody wants to talk about. We're going to talk about urinary incontinence. So stress incontinence. There are a few different kinds of urinary incontinence, and I'm just going to briefly talk about the one that mainly affects persons with cystic fibrosis. It affects men, it affects women, and it doesn't matter if you are a woman who has had a baby or who has not had a baby. It can affect both people, and it can affect, I want to be loving and kind. If you don't identify as either one, you still can have urinary incontinence and we can still help you. So, the pelvic floor muscles get weak, and this can include atrophy, loss of motor control, and atrophy is a shrinking of that muscle. And all of that support the bladder. And there's a picture on the next slide to show you that. It supports the bladder neck. When those muscles get weak, and there are things like increased abdominal pressure, I'm bending down to pick something up, I'm coughing, I'm sneezing, I'm pulling, I'm pushing, maybe I'm doing a sports activity. Anything that increases that abdominal pressure will push down on that bladder. And if those muscles are leak, you're going to get leaking of urine, which is such a bummer. It is embarrassing, it is uncomfortable, but with activating our core and getting it stronger, you can get better. What I will say is that it takes time. It takes longer than that 10-minute walking program to get your pelvic floor strong. It took a long time for it to get weak, and you did not recognize it, and that's okay. So put in the time to get it stronger. It is a maintenance program, and so be open to the fact that you're going to see improvements relatively soon because you're bringing awareness to that part of your body, but it's going to take about 4 to 6 months to get stronger. And I know that that's a bummer. If you take away one thing from my talk, don't push when you pee. I don't care if you're a man or a woman, don't push when you pee because that's increased intra-abdominal pressure that your body doesn't need. So just relax and let it go. Okay. So the deep core, which was on the picture before, um, during an increase in intra-abdominal pressure, the pelvic floor muscles, we would like them to close. We would like them to come together. So if you feel comfortable in your chair, no one's going to know you're doing it. Go ahead. If you are a woman, I want you to think about closing the elevator doors, holding those doors closed, and slowly bringing the elevator up. I'm doing it right now. And it's hard. And I'm still talking. And that's when we know those muscles are activating. Okay. If you're a man, you want to think about walking into cold water and lifting your body up. Okay. So you're going to feel things move because of the way that the muscle attaches to the and the back of your pelvic floor. I don't need to get too detailed because you can see it here and you can feel it. So if your body doesn't know how to do what I'm asking you to do because there's a long history of diminished motor planning, how can you have anticipatory control? I feel a cough coming. It's going to be a big one. I just leaked. Okay. So one thing I would like us to try to also take away from my discussion today is doing that activation. Squeeze before you sneeze, squeeze before you cough. If you can prep, then you can, sorry about the feedback, you can address and reduce some of that urinary incontinence. It's also important to recognize that there are two types of muscle fibers, even in this part of the body. 30% are fast twitch, which means they burn out fast, and 70% are slow twitch, which are our endurance muscles. So we train them differently. You have a long hold for those muscles, and then you have a quick firing for the fast twitch muscle fibers. I love it when I get the makes me know I'm making you think. Okay. So what are some general tips for improved strength? 10 5-second firm contraction, so that sustained hold, and then a 10-second rest. That rest is important to let those muscles fully relax before we go into our next contraction. And that's hard. I think we're in a society where everything is so fast and let's go, let's go, let's go. But this is your time to sit and go ahead and relax and rest while we're also doing something very meaningful for your body. It's a lot. It's 50. It's 50 repetitions. And that's just the endurance muscles. For our fast twitch muscles, it's 10 quick flicks of that same motion that I was asking you to do earlier. You're turning it on, you're turning it off, you're turning it on, you're turning it off. There is somebody, and I wish I would have referenced her on Instagram. She's probably on TikTok too. She's also, she is a physical therapist who specializes in women's health. And she will say, okay, close the elevator her own way, close the elevator doors, bring it up and hold, and relax. And now 3 quick, and I'll do them with her because that's, when else am I going to do it? I got to remember, right? Just like all of you, we have all of these things to keep in mind throughout our day. Then you add those muscle activations to the things that make you leak. Picking up that item from the floor, smacking the plant on the stage, picking up your cup of coffee, opening the door. Those are the same things that we do when we are training our muscles, our deep core to help keep your back stable. So if I'm going to pick something up, I stop before I pick it up and I tell myself activate and exhale because I'm a back patient. So if you can start to incorporate those things, some of these muscle activations into your golf swing, into your pickleball hit, along with an exhale, then you're going to be protecting your pelvic floor, you're going to be improving your core strength, and it's all going to start to come together. Okay, so final thoughts. Create a recipe that works for you. Maybe it's chair yoga and walking. Maybe it's strength training and foam rolling. Maybe it's walking and mixing in that pelvic floor training in the morning when maybe you do a morning meditation. Maybe it's when you're listening to your favorite podcast. Remember to address good posture when you're working and then also when you're on devices. And accountability helps. Patients come to therapy and they're like, I've been doing my exercise program because they know they're going to see us, right? Having an accountability buddy, hey, can you text me a few times a week to let's go on a walk? I have a reminder in my phone for myself that says, take care of your body. It used to say workout, hit the gym, let's go. But I'm in a different season of my life. So I'm looking at it as taking care of my body, but I'm also another one that I use is let's dance it out because I love dance. I've always done it since I was a kid. It makes me happy. I would much rather dance in my house in my pajamas, get all sweaty than pay to go to the gym. That's just what I would rather do. So if going to the gym is your jam, do it. And then remember, I guess I'm talking about it, enjoyment helps. Go to the green space, listen to the podcast, listen to the music, listen to the book, anything that will help you get to the place of incorporating these activities. And then I'm just going to show you a few resources because I know we are out of time. But some of the resources that I like, please feel free to take pictures of these slides. There is a chair yoga, yoga with Cassandra. I know that avoiding head down is important for persons with CF. She really doesn't do head down because she's in a chair. But I think if you're sensitive, knowing that you can use a pillow is very helpful. I love Yoga with Adrienne. She has multiple exercise videos with back pain, for back pain. But I know that some people have trouble getting into the hands and knees position, or their neck is weak. Maybe they don't feel comfortable getting on the floor. So then trying the yoga with Cassandra is a great option. Foam rolling is wonderful because it can address the upper part of your spine, which can be very stiff, and then the lower part of your spine where the muscles grip to help reduce that tightness. Using a foam roller is wonderful. This is a physical therapist. He has a lot of videos. I will say that I'm new to him, but when you are trying things on your own, if it doesn't feel good, don't do it. So listen to your body, but some of these are fabulous. And then here's a resource. I believe in USC, they are very dedicated to their physical therapy practice. They do telehealth appointments. The key is they will ask you, does your insurance take telehealth? Do they support telehealth financially? And if you say yes, they're going to be like, okay, they're going to charge you. So they're not necessarily going to do the legwork. I think knowing that information up front is important. But these are persons who are dedicated to working in, they have that certification in orthopedic. Oh my goodness, I'm fumbling on my words because I know I'm out of time. Orthopedic specialty, women's health, so they can meet with you virtually as well. And these are some resources that I can't not share that I know a lot of you know about, but there are exercises online. There is yoga specifically taught by persons with cystic fibrosis. That's cfyogi.org. We know that Taylor Lewis is a person who participates in CFRI, and there are a lot of benefits to working with him. There's also something called Breathe Like a Boss Foundation, which is a patient of mine who had a lung transplant, and he has a grant for persons who are looking to exercise but maybe need some financial support. So that's also another resource for you. And just because, I made some changes this morning that I forgot. I wrote citations, but also bibliography, because I didn't do the scientific work of putting in each and every citation. But if you are interested in articles, here are some to look at. And again, I'm honored to be here. I hope you take something away from this today, and thank you so much.